Wash your hands thoroughly before beginning the procedure. Once you are ready, prepare 3 to 4 strips of 1-inch adhesive tape, approximately 3 times the diameter of the extremity. Next, prepare 2 strips of 0.5-inch adhesive tape, one approximately 3 times the diameter of the extremity, and the other approximately 2 inches long. Place these tape strips on the edge of the table that you are working on. Remove all hair over the cephalic vein and all the way around the extremity with the clippers as seen here. Soak 4 cotton balls with alcohol and 3 with chlorhexidine or betadine scrub. Surgically prepare the entire clipped area by starting at the designated entry site for the catheter and wiping with an alcohol-soaked cotton ball in a circular outward motion. Alternate between alcohol and scrub-soaked cotton balls. The 3 scrubbings and final alcohol wipe will produce a clean site for the placement of the catheter. Using a dry 4x4 gauze, dry the area on either side of the vein, but do not touch directly over the vein. Once you have surgically prepared the catheter site, wash your hands again. For increased visualization of the vein, have your assistant hold off the vein above the catheter site just below the elbow. Use your hand to hold the distal leg and apply mild traction to the skin on either side of the clipped area. This will help you to be able to see and stabilize the vein. With your other hand, hold the catheter with the needle held at a 15 to 20 degree angle to the vein with the stylet bevel pointed up. Use the hand that is stabilizing the extremity to simultaneously hold the hub of the catheter stylet. Be sure to start at the distal end of the vein. This way, additional attempts can be made further up the vein if the first placement is missed. Insert the stylet and catheter through the skin and into the vein using a steady forward motion until you see blood flow into the needle hub. This should occur with minimal resistance if in the proper location. Remove the stylet from the catheter and attach the IV T-set or injection cap. Without touching the catheter, the hand can apply slight pressure over the tip of the catheter to minimize bleeding while the T-set or cap is secured. Inject the catheter with sterile heparin flush and observe for swelling or formation of hematoma under the skin. If swelling or hematoma develops under the skin, remove the catheter and apply a temporary pressure bandage using a cotton ball and 1H tape. If this occurs, select a new entry site further up the leg. Use the longer strip of 0.5-inch tape to secure the catheter hub around the extremity. Place a Band-Aid with triple antibiotic ointment over catheter insertion site as shown here. Wrap a strip of 1-inch tape around the catheter hub and Band-Aid, securing them to the extremity. Anchor the T-set to the hub of the catheter using the shorter tip of 0.5-inch tape in a V fashion. Next, wrap a second strip of 1-inch tape over the anchor and catheter. If fluids are being administered, attach the fluid administration set to the T-set, open the IV line, and observe for adequate flow into the vein. Continue to also observe the leg for swelling associated with an improperly placed catheter. If fluids are not being administered, screw on the IV injection port and inject the port with heparin flush. Wrap another strip of 1-inch tape to secure cap to extremity. Tape is not likely to stick to wet surfaces, so if there is fluid or blood present on the leg or items to be taped, clean and dry them prior to taping.